Okay. Good morning, good afternoon, and good evening, everyone. I'm Associate Professor Police Lieutenant Colonel Krishnapong Putukul. Today, I'm going to talk about the Asia-Pacific region. I would focus on four main issues: harm reduction, response to COVID-19, gender-based violence, and mental health issues. With regard to harm reduction, many countries have implemented harm reduction programs like Afghanistan, Bangladesh, Colombia, China, Hong Kong, India, and other countries on the country list you can see on the screen. Most of the programs were led by NGOs and civil society in collaboration with government agency and public health sector. However, there are still some problems, like legal issues and law enforcement dilemma. And they still have a big challenges like the narrow scope are limited to a specific area. I have one good practice in Vietnam. The police mediate that legal and social assistance to drug users there. They have the idea of a community-based program and strong cooperation led by the police. And respond to COVID-19, a variety of ways in response to COVID-19 in Asian countries. They have used a technology-based response like a robot, mobile phone, drone. They also use the community-based response like volunteers, and they use social media to raise public awareness. And law enforcement agencies partner with public health sector depending upon resources. And I have one good practice in Thailand, in my home country. In Thailand, they have a home visit for those returning from risk areas, and they have a preliminary health check and report. They work together with local police officer in terms of local quarantine and home quarantine. With regard to gender-based violence, some countries have vigorously implemented programs related to gender-based violence. These include India, Pakistan, Sri Lanka, Bangladesh, and Maldives. They have two categories of the program. The first one is prevention-oriented, focusing on men or offenders. And the second one is a victim assistance-oriented, focusing on providing help to victims, mostly led by NGOs and civil society. Again, they still have a narrow scope limited to a specific area, like not enough public resources and public trust toward the police. I have one good practice in Pakistan. The police set up the training program in partnership with the Islamabad Capital Territory Police and the National Police Bureau, the National Police Academy, Provincial Police Training Wing, and various police colleagues and the school. They also built and the capacity and enhance the sensitivity of the police personnel for the response. And for mental health issue, many mental health related programs were implemented in Asian country, mostly carried out by the government agency and health core sector. Limited roles of law enforcement agencies still. I have one good practice in South Korea called Psychological Autopsy Project for Suicide. It aims to analyze the causes of suicide and prevent it since 2015. And they have the Korea's psychological autopsy checklist. And the police provide information on suicide victims. The Ministry of Health and Welfare Central Psychological Center conducting PA analysis of the cases. It's all my presentation. Thank you very much.